One of the first things that you're going to do is to know where you can get good information so that you can make an informed decision. We recommend that you go to government sites such as healthcare.gov for the federal marketplace or your state marketplace site, which should also have information. Government sites are required to provide full information on all of the Affordable Care Act plans that are available to you in your area. They are not allowed to offer plans that do not comply with the Affordable Care Act. And they also have to accurately determine eligibility for subsidies. I can't say the same for non-marketplace sites. They may not offer the same information so that you're not able to compare one plan to another in a reasonable way. They may not offer the full range of plans, and they may offer plans that do or don't comply with the Affordable Care Act. If, for example, there's a plan that is being offered to you that does not provide the 10 essential health benefits, then you know it's not an Affordable Care Act compliant plan. And you just have to think about when you go to these sites, what is it that they're trying to get from you? Chances are they're trying to get you to sign up for a plan through them. But if you're going to a news source or a financial advice website, then they're not asking you to buy a plan from them. So you can read that information and you can assume that it will generally be reliable if it's from a reliable source. For example, I recently read an article through the New York Times, and that was very clear about some things about health insurance. I listened to something on The Motley Fool, and there too, it was very helpful. It was very clear. Just make sure that you're going to a site where you can get reliable information. When you're enrolling for a plan through the federal marketplace, there are a number of ways that you can do this. Some you can involve an agent or a broker or an assister, which they can either contact you if you request it, or you can contact them. You can use a certified enrollment partner's website. You can apply online at healthcare.gov. You can enroll by phone through the marketplace, and you can also complete a paper application and send that in. The benefit of talking to someone is that they will be able to tell you what premium is required, when it needs to be paid, answer your questions, things like that. But many, many people apply online and do just fine. And it just depends on how comfortable you are with the process. When you pay your premium, you will generally do it through an online portal. However, you can also pay by check. Just choose an option that's convenient for you. I am now going to turn this part of the program over to Hannah Frigand, who is the Director of Education and Enrollment Services at Healthcare for All. Healthcare for All is a nonprofit organization based in Boston that works to ensure that everyone in Massachusetts has the equitable, affordable, and comprehensive care that they need to be healthy. Hannah started working at Healthcare for All as an intern in 2006 and later joined the Healthcare for All team as a helpline counselor. She's now in the position where she manages the day-to-day operations of the helpline. I thank you so much for being here, Hannah, and I turn it over to you.
All right. So I'm going to discuss some best practices for shopping for health coverage through the marketplace. So it can be an overwhelming process when you first log into the marketplace to compare plans side by side. So there's certain things that I recommend considering when you look at the different plan options. So there's a variety of ways of filtering plans out to make the best choice for you and your family. So sometimes people have preferences for what insurance carriers that you work with. There's choosing ones that are in your price point for the monthly premium cost. There's making sure the insurance network has your providers. I'm going to talk a little bit more about all of these different things and how to go through the marketplace and find what you're looking for. If you're shopping for health insurance and you are already know the specific doctors that you want to have in network, that's probably the best way to start, because that's a good way of filtering down the insurance options. So if there's primary care specialist, behavioral health specialist, that's a good way for you to whittle down an overwhelming number of plans. And from there, you can look at what the monthly premiums will be, which is just one aspect of the cost sharing that you would face when using your plan. When you're looking for through the provider networks of plans online, I always recommend contacting the doctor's office before making a final determination, because provider directories change. Sometimes they're not updated in real time, and it's really important to double check with the doctor's office. Sometimes doctor's offices will have what they call closed panels, and that means that they might not be accepting new patients for different insurers at that time, and that changes regularly. So it's really important to contact offices if you want to make sure you'll be able to continue to see them. So there's shopping guides available online that can help you map this out. You can use it like a worksheet to work through what you expect usually to be using for medical services, what might be realistic expectations for services that you may use but not regularly. So you want to look at like inpatient hospitalizations or other specialty services that may happen once in a while but not regularly. So these are really important to consider, in particular for behavioral health, because it can be very complicated to make sure that you have both a plan that's going to meet your network needs and the cost. When applying for health insurance, it's a good opportunity to check if you can qualify for subsidies. You might be surprised that the income level for a family of 4 is $100,000 a year to qualify to get tax credits to lower the monthly cost of health insurance. So I would advise you to check to see if your family might be able to get assistance through advanced premium tax credits through the marketplace. Advanced premium tax credits can lower the monthly premium, and it's just important to make sure that you are filing taxes with that information, because you will need to do what's called reconciling at the end of the year. When you reconcile, you are using the amount of tax credits that you received for assistance and matching that to what your income ends up being for the tax year. So you want to be conservative and make sure that they're going to be relatively close so that you're not responsible for paying back any of the tax credits. You can also get cost sharing reductions, which help with lowering the copays and deductibles in addition to advanced premium tax credits. That's to a lower income threshold, but that is another opportunity to lower your out-of-pocket costs. So you can get this information by applying through the marketplace and seeing if you would qualify, and enrollment assisters can assist you with that. One thing that's important is there isn't one plan that's going to be right for everyone, and there isn't going to be a perfect plan. It's going to be give and take, making sure that you're choosing a plan that you can afford to pay the premiums for and the cost sharing, and that have enough of the providers and coverage that will meet your needs. We know that this can be an overwhelming process, and just take a breath and know that there's assisters out there that can help you. Just make sure that you take your time to do your homework and choose a plan that you will feel comfortable taking. But help is out there, so if you're feeling overwhelmed, you can reach out to enrollment assisters to assist you and make a good decision together.
Thank you so much, Hannah. I really want to underscore something that Hannah said. There is no perfect plan, so just try to find an insurance plan that meets your family's needs the best you can, considering access to providers, medication costs, premium affordability, and cost sharing expenses. And if it doesn't work out to be the best for your family, you can change it next year.